Hello. Welcome to our third webinar of 2019, where we will be doing a spotlight on QQFS. QQFS was acquired by M3 Global Research in September of 2017. I'm Monica Gilson, Marketing and Events Manager for M3 Global Research. Before we dive in, I wanted to let you know that we will be taking questions at the end. You can submit them at any time during the webinar using the Q&A function. If you have any technical difficulties, please use the chat function. Both of these options are available in the webinar console. Our QQFS team has over 20 years of experience conducting fieldwork in the Nordics, Benelux, and Alpine markets. I am joined today by a few members of our QQFS team, Alexandra Benoit, Hannah Gorgas, and Stephen Anderson. Alexandra Benoit is the head of business development and has been with QQFS since 2012. She held several different positions within the company before leading the sales team. Her knowledge and understanding of fieldwork allows her to advise clients on the best approach and solution for their project. Hannah Gorgas joined M3 Group in 2015 and is the Deputy Operations Manager of Global Operations at QQFS. Hannah has built her career in a variety of roles within the market research industry prior to her current role heading up the operations team. This includes leadership of both the qualitative and quantitative sectors, where she oversees project delivery and excellence in client services. Stephen Anderson is a client service director whom joined QQFS in 2014. His role involves ensuring the satisfaction of existing clients and communicating with potential clients. Stephen uses his detailed market understanding to prepare achievable recommendations for his clients' fieldwork needs. I'll now hand it over to the QQFS team to get started.
Hi, this is Alexandra. Thank you very much, Monica, for the introduction, and welcome to everyone who joined us today. During this webinar, we will talk about QQFS, who we are, what we do, what makes us the best partner to conduct market research in the Nordics, Benelux, and the Alpines. We will refer to the Nordics, Benelux, and the Alpines as the QQFS market. And for those who doesn't know, QQFS stands for Qualitative and Quantitative Fieldwork Services. At the agenda today, we will start with sharing our 20 years of experience, what QQFS is known for, and our expertise. We will talk about QQFS capabilities, our coverage, and panel information. And finally, QQFS as part of M3 Global Research, we will cover the benefit of being part of a larger group and how it affects positively fieldwork and therefore clients. It all started 20 years ago when QQFS was founded in Gothenburg. It was initially a family-run business until it became part of M3 Global Research in September 2017. As fieldwork agency, we are specialized in providing data collection service, but what makes our offer so specific is the market we are covering. Everyone knows that when you run study in the Nordic, Benelux, and the Alpine, we can all agree that these markets are the most challenging in Europe. It's mainly due to the small population and therefore the small universe size of doctor. Most field work, including recruitment and moderation, is done from our office in Gothenburg. We count over 14 nationalities in our office. Gothenburg is the second city in Sweden with about 572 inhabitants, and it's a very multicultural city. We do not rely on our panel recruitment. We do not only rely on our panel to recruit. We customize recruitment to offer the highest sample possible. We can recruit any type of healthcare professional, patient, stakeholder, including the most difficult target group. And finally, QQFS is known for its knowledge and being the expert in the Nordics, but also in the Benelux and the Alpines. Our journey has led to create the largest global healthcare community within the QQFS market. For 20 years, we have developed a database of doctors nurse, patient, and key opinion leader, and we can proudly say that we have the largest reach in this market. Alongside, we have accumulated knowledge on indication, we have learned specifics per target and country, and we have a great understanding of each healthcare system. We can see similarity between markets, whether each market works as one market on its own. Our recruitment team is not only working on getting respondents completing study, they think long-term, build a strong relationship with participants by providing a personal support. The trust that panelists have in our team is reflected in the high response rate when running studies. We can see a 40% response rate when we invite our panelists. Because we do not only rely on panel recruitment, we are also able to reach difficult target group like payer, patient association, and rare disease stakeholder. Our recruitment team has great experience in this key area and know what's the best approach to get this stakeholder on board. Our sales team is working in close collaboration with fieldwork team. In fact, most of us has been working as recruiter or project manager before joining the sales team. We have a good understanding of the fieldwork and the associated challenge. We have a good knowledge on what we can do in this market, and we can therefore provide a good recommendation and feasibility to our client. If an approach is not feasible, we will suggest alternative solution. When a sample is not feasible, we will provide you sufficient feedback for our client to put the information in their proposal. We are also able to review screener and advise at early stage on appropriate screening criteria. We can all agree that wrong criteria like patient case load will affect negatively the delivery of a study. It's essential to work with accurate and representative screening criteria in our market. This information will show how screening criteria needs to be adapted per country and not associate the QQFS market with the European market. So according to the OECD, the Organization for Economic Cooperation and Development, Health at Glance Report 2017, out of 37 participating global markets, Sweden has the lowest number of consultations per doctor. We are looking at 692 per year compared to, for example, Germany, 2,416, and Korea, 7,140. Because of this, we can appreciate the patient case load for Sweden cannot be the same as Germany. We need to adapt the screening criteria based on each country specific. If you have any doubt, feel free to share the screener with our team and we can review. We are here to assist. I will now pass you over to my colleague, Hannah.
Thank you, Alexandra. Hello, everyone. I will actually just cover a little bit of what our QQFS capabilities are. So as Alexandra has already mentioned, our offices are based in Gothenburg and they actually house a various number of different teams. So we have a moderation team in-house that is able to cover, as I said, moderations as well as some qual outputs. We have an in-house translation team that directly liaises with linguists and helps coordinate the completion of translations and delivery. We, of course, also have a recruitment team, and we actually did some research on our panel and discovered that one of the factors they appreciated the most about being part of the QQFS panel was the personable approach and the direct contact with team members. And this has allowed us to maintain and grow a panel of specialists. We, of course, also have a project management team, and they coordinate and work with all other departments and teams, as well as, of course, our clients and any other stakeholders, to ensure that we pull through first-class client services to deliver the best of our abilities. They would also coordinate, of course, where required, with our trusted suppliers that are briefed and trained to ensure they deliver on the same level of quality that we expect to deliver to our clients. And last but not least, we have our sales team. We have 5 members in this team, and they're available to provide quotes of information on feasibility, but also guidance and recommendations on project material to aid our clients to be in the best position for the project lifecycle. Now, if we look at the facilities in a little bit more detail and focus on our actual methodologies that we cover in-house, so around 40% of the projects that we field are qualitative projects. So they range across a various different type of project and can be as simple as web-assisted TDIs, but also we cover more complex studies such as focus groups or facility bookings, etc. We cover a wide spectrum across the board, so that's telephone in-depth interviews, web-assisted telephone interviews, webcam TDIs, face-to-face research, focus groups, online bulletin boards, and ethnography. Then looking at our quantitative projects and how many of those we field, so we cover approximately 60% of our projects that we field are quant. Out of these, we have about 90% that would be what we would consider, let's say, our standard online projects. However, putting the more standard projects aside, in terms of online only, let's say, we do also do have the capabilities of covering CATI type projects, as we have a dedicated recruitment team that can handle that type of methodology. We also cover and can help and support on mobile surveys, projects that contain patient record forms and charts, of course, with the exception of markets where these are exempt due to local legislation such as Sweden and Finland. In terms of list recruitment, we are quite strong and can support as well, as we can in theory work on both our matches, so that would be matches to our panel from a list, as well as, you know, GDPR compliant lists where we're allowed to work on non-matched sample. Then lastly, from my side, looking at our strengths in terms of additional recruitment methods that surpass, you know, just the standard contact to our panel. We have various different avenues of recruitment in terms of desk research that we can run in order to gather more information and details about recruiting specific specialties. We can cover LinkedIn as a form of social media recruitment. We have our in-house recruitment team that covers all the languages abilities that QQFS covers in terms of their markets, such as Dutch, Norwegian, Finnish, German, etc. We can work on GDPR compliant lists, carry out referral campaigns, any other form of suggested social media campaigns, and we also have a strong collaboration with patient associations. So that is all from my side at the moment, and I'll hand over to my colleague Stephen.
Thanks very much, Hannah. Stephen here, and I'm going to talk to you about QQFS's coverage and panel information. So in this slide, we've highlighted our core markets. As you'll see in the table on the left, the population sizes are relatively small when compared with other markets. To put it into context, the total combined population of these markets is less than that of Germany. In Norway, Sweden, and Finland, you see vast expanses of land, which are less inhabited and colder the further north you go. The significance of this is that the smaller populations go hand in hand with smaller HCP universe sizes. So in terms of groupings, we often see these countries referred to as Benelux, and that's Belgium, Netherlands, and Luxembourg. We haven't given any details on Luxembourg there because it's really, really small. We don't tend to do too many studies there, but we can, and we do have coverage there if required. Then we've got the Alpines, which is Austria and Switzerland, and the Nordics. So we have a few terminologies for the Nordic and Scandinavia markets. So Scandinavia refers to Norway, Sweden, and Denmark, whereas the Nordics also includes Finland and Iceland. Iceland isn't a market that we actually cover. They don't generally tend to get too much demand for Iceland. In addition to these markets, we also have capabilities in some of the Eastern European markets, and we can field these markets in combination with one of our trusted suppliers. So moving on to this next slide, panel statistics, completes in 2018. So QQFS is very well known for the Nordics, but Belgium and the Netherlands are actually two of our strongest markets in terms of the number of completed interviews. So here we've listed the number of completes that we delivered per country in 2018, ranging from 4,500 in Belgium down to above 500 in Norway. You see all the flags there on the left. The Swiss flag is actually one of only two square sovereign state flags, the other being the flag of Vatican City. So the next slide is QQFS's panel. The QQFS panel is made up of over 13,000 panelists in these markets. This means that we've got the largest combined panel in the industry for these markets, and we're striving to continually grow and update this. Since the implementation of GDPR, our panel's grown by 30%. So the significance of small universe sizes and having the largest panel in the industry and a high response rate, as Alexandra mentioned earlier, 40%, means that QQFS can deliver the best feasible sample sizes in our markets. How do we grow the panel? So we're running fresh recruitment on each running project. So not just relying on panel, we're looking beyond that. And some examples of how we're growing the panel are we're getting referrals from HCPs, we're recruiting via LinkedIn, we're recruiting via conferences, and we're conducting phone recruitment. In addition to that, we've conducted marketing campaigns, social media using marketing technology, and our marketing team working for our markets. Also, more resources. So now we've got a global panel team based in Sweden, UK, and the US, with native recruiters offering local knowledge. So the importance of incidence rate in small universe sizes. So with small universe sizes, it's very important to get representative criteria. We have a low amount of treating doctors, so our aim is to have no screen outs as long as these doctors are relevant for the indication of the study. This leads to happy respondents, a high response rate, in turn, successful projects, and happy clients.
So now we are going to talk about QQFS as part of the M3 Global Research. So since the acquisition, QQFS is enjoying the benefit of being part of a large group while remaining independent. We have access to new technology, more support, more structure, and all this to continue improving our service to existing and new clients. So what has changed really? I believe that the most important change has been the conversion of our database. As I said earlier, we used to work with a database, a large collection of respondent information. However, in order to be GDPR compliant, we had to convert this database into a panel where basically physician needs to sign in and consent to be contacted for market research. M3 Global Research already had a platform, already went through the process a few years ago, so it was kind of simple for us to go through the process. Actually, the conversion started end of 2017 and was ready by May 2018, sorry. So it took us less than 6 months to convert our database. At this stage, on May 25th, we converted 90% of our active respondents, and by the end of the year, we end up over the sample we had before the conversion. So everyone who went through this process, we know how it can be challenging, but we can say, as today, that it has been a great success at QQFS.
In terms of the next point, we have a consistent process internally across all of our projects, and that's across all of our M3 Global Research offices. And this allows for better usage of our resources and ensures that all of our clients are provided the same first-class experience across all of our offices.
Regarding this point, I mean, everyone who has been working with QQFS know how much we have always been engaged and quite strict with compliance. We apply that. We have strict process when it's come to fieldwork, just to make sure we follow market research code of conduct and any type of local regulation. So we have now, since we are part of this larger group, we have now access to a global compliance team, so not just QQFS, and we will advise internally as well as externally about local laws, local code of conduct, and we will follow ISO standard certification. Note that QQFS is not yet ISO certified. However, we are aiming to be ISO certified by Q1 2020. And here we are talking about ISO 26362 for the access panel. We also have a DPO that has been appointed and can provide advice on data protection and ensure that the business stay compliant under the GDPR, UK Data Protection Act 2018, and also the EU-US privacy sheet. Finally, we have a local legal department who focus on reviewing any type of legal documents such as MSA or DPA that we can that are needed with client and supplier.
We're also receiving continuous investment from M3 Global Research to extend our reach and maximize sample delivery. Some examples of that are investment in our operations platform, the global compliance team that Alexandra was talking about, and a marketing team.
Due to this has actually helped in terms of our project setup and launch timings. And we were able to significantly decrease the time spent on project setup and able to move into a swifter launch due to the implementation of the new technology that we received.
So in order to ensure project delivery, QQFS is now open to outsourcing recruitment. In the past, we had a policy that we would only recruit internally and we would not outsource. This is still our main objective. However, we are now able to supplement our recruitment with another fieldwork partner in order to maximize project delivery. For example, 97% of our completed interviews are sourced from internal panel versus 3% which are outsourced. As part of M3 Global Research, we also have increased support when it comes to procurement.
Okay, so just to summarize, QQFS has 20 years of experience within the Nordics, but not only, in the Benelux as well and the Alpines. Most fieldwork can be done daily, can be delivered internally. We will, as just mentioned by Steve, we try to outsource if we need to complete a project. However, our main objective is still to deliver as much as possible internally and continuously grow our panel. We have the largest panel in the industry across all of this country, and we are continuing growing the panel on a day or on a project to project basis. We have access to new technology and resource, which will help us to fulfill our ambition, which is to reduce timeline to turn around project, maximize delivery, and excel at customer service. So that's for today.
Thank you all so much. We do have a few minutes for Q&A, so if you haven't submitted a question and you have something you'd like to ask, please do so using the Q&A function. And now I will allow Alexandra, Hannah, and Stephen a few moments to go through the questions submitted. Following the webinar, you guys will be taken to a survey where we encourage you to share your insight on today's presentation. We also look forward to your suggestions for future webinars to ensure we're covering relevant and useful topics. We will be hosting our next webinar in the middle of June. Look out for an invitation in your email in the next few weeks to register for that. Now over to our QQFS team with your questions.
So we've had one question coming in here. You mentioned in an earlier slide that Sweden had a very low number of consultations per doctor. Is there any particular reason for this? It's a good question. So there are a few factors there. I think that one of the countries that it was compared to was Korea. So some countries, doctors are paid on a fee-for-service basis, i.e. Japan, Korea, and they tend to have an above average consultation rate. While countries with mostly salaried doctors, i.e. Finland, Sweden, tend to have below average rates. In Sweden and Finland, the low number of doctor consultations may also be partly explained by the fact that it's quite difficult to see a doctor in some circumstances. So you may be seeing a nurse or another health professional who is playing more of an important role in primary care, in health centres. So that lessens the need for consultations with doctors. There's also technology here where you're actually having a virtual consultation. So, for example, my daughter, when she was ill, I don't actually necessarily have to go into an office. I can dial into a sort of Skype app and talk to a nurse via the app. So those are some of the reasons that explains why that number of consultations per year is so much lower than other markets.
Awesome. Thank you for that. Are there any other questions?
No.
Great. Thank you so much to our QQFS team and all of you for joining us. If you have any additional questions, please reach out to us at marketing@usa.m3.com. And then you also have Alexandra's contact information here if you would like to reach out to her and the QQFS team directly. Later this week, we will be sharing the full audio and video recording of this webinar, including a copy of the presentation. If you're interested, you can also find our previous webinar recordings in the resources section of our website. So that is all for today. Thank you so much for joining us and enjoy the rest of your day.
Thank you.
Bye, everyone.
Bye.